Welcome back. I'm an emergency doctor actively working at the emergency department of my hospital. In this Doctor's Corner series, we'll dive into lesser-known approaches and hidden strategies to help the people with critical illnesses. You can subscribe if you want to learn the latest news and healthy solutions about your health. Good day, everyone. Today, focus on the skin not as a surface to be punished, scrubbed, dried, and controlled, but as a living immune organ. Look at acne this way. It is not simply dirty skin, and it is not simply too much oil. It is a complex inflammatory event happening inside the pilosebaceous unit, the tiny structure where the hair follicle, sebaceous gland, keratinocytes, bacteria, immune signals, and oxidation all meet. Now ask the first important question: why would vitamin C matter in acne? At first, vitamin C sounds more connected to colds, citrus fruit, or brightening creams than to inflamed pimples. But pause there. Acne is not only a pore blockage. Acne involves inflammation, oxidative stress, barrier disruption, delayed healing, and post-inflammatory pigmentation. Vitamin C touches each of those pathways. That is why we must not think of it as a magic eraser. Think of it as a strategic support ingredient, one that may help calm the battlefield, protect the surrounding tissue, and improve the way the skin recovers after inflammation. So listen carefully. Do not treat vitamin C as a replacement for evidence-based acne medications when acne is moderate, severe, scarring, cystic, or hormonally driven. Use it as an intelligent adjunct. Use it with judgment. Use it in the right form, at the right time, and with the right expectations. The American Academy of Dermatology's acne guidance continues to place core treatments such as benzoyl peroxide, topical retinoids, topical antibiotics when appropriate, oral antibiotics in selected cases, hormonal therapies, and isotretinoin for severe or refractory acne at the center of medical acne care. That matters because vitamin C should be positioned correctly, supportive, not heroic. Helpful, not absolute. Now ask, how can one vitamin influence so many acne-related processes? The answer lies in three biological roles: antioxidant defense, collagen support, and pigment regulation. And once you understand these three roles, vitamin C becomes much more than a trend. It becomes a tool. Start with inflammation. When a pimple forms, what is really happening? A follicle becomes clogged with sticky dead skin cells and sebum. Cutibacterium acnes interacts with that environment. Immune cells respond. Inflammatory mediators increase. The area becomes red, swollen, painful, and sometimes filled with pus. But beneath that visible redness is a chemical storm. One part of that storm is oxidative stress. Think of oxidative stress as biological sparks being produced faster than the skin can safely neutralize them. These sparks, reactive oxygen species, can amplify inflammation, irritate surrounding cells, and contribute to tissue damage. So ask, why does this matter practically? Because if acne is partly driven by inflammatory oxidation, then strengthening antioxidant defense may help reduce the intensity of the environment around the lesion. Vitamin C is one of the skin's major antioxidants. It helps neutralize reactive oxygen species and supports the broader antioxidant network of the skin. A dermatology review in the Journal of Clinical and Aesthetic Dermatology describes topical vitamin C as a powerful skin antioxidant with photoprotective, collagen-supporting, and pigment-regulating actions. Now be precise. Do not say, vitamin C cures acne. Say this instead. Vitamin C may make acne-prone skin less vulnerable to oxidative irritation, may support repair after lesions, and may help reduce the visible aftermath of inflammation. That distinction is important. Acne treatment is not only about stopping new lesions, it is also about reducing redness, preventing dark marks, supporting healing, and preserving texture. Many people say, my acne is gone, but my face still looks like I have acne. Why? Because the lesion may disappear, while post-inflammatory erythema, hyperpigmentation, and early textural change remain. This is where vitamin C becomes especially valuable. Ask the second question: how does vitamin C help the skin repair itself? Vitamin C is required for proper collagen synthesis. It is involved in the hydroxylation of proline and lysine, steps that help collagen molecules form stable structure. In plain language, collagen needs vitamin C to be built correctly. When a pimple becomes inflamed, especially a deep papule, pustule, nodule, or cyst, the surrounding dermis can be stressed. The skin must remodel, rebuild, and restore order. So give this instruction. Protect the healing phase as much as you treat the breakout phase. Do not obsess only over drying the pimple. Support the skin after the inflammation. Use sunscreen. Avoid picking. Keep the barrier intact. Consider topical vitamin C if your skin tolerates it. Why? Because the quality of healing influences what remains after the bump goes down. Now let us talk about marks. After acne, some people develop red marks. Others develop brown or grey-brown marks. In deeper skin tones, post-inflammatory hyperpigmentation can last longer than the acne lesion itself. Why does this happen? Inflammation can signal melanocytes, the pigment-producing cells, to produce more melanin. That pigment may linger after the original lesion has resolved. Vitamin C can help here because it has anti-pigmentary activity. It can interfere with excess melanin formation and help brighten uneven tone over time. Again, be careful. It does not bleach the skin. It helps regulate uneven pigmentation. It is not an overnight correction. It is a gradual influence. So ask, how should someone use this knowledge in a real routine? Do this. Choose the form carefully. Not every vitamin C product is the same. This is where many people fail before they begin. They buy a high percentage serum, use it on irritated acne-prone skin, feel stinging, then conclude that vitamin C is bad for acne. But often the issue is not vitamin C itself. The issue is the form, concentration, pH, packaging, oxidation state, and formula base. L-ascorbic acid is the active form most discussed in dermatology, but it can be unstable and acidic. In acne-prone or sensitive skin, a strong low pH formula may sting, disrupt comfort, or aggravate an already inflamed barrier. So do not chase the highest percentage. Choose compatibility first. For acne-prone skin, pay close attention to sodium ascorbyl phosphate, often abbreviated SAP. Why? Because it is a more stable vitamin C derivative, and it has been studied specifically in acne. A randomized, double-blind controlled trial of 5% sodium L-ascorbyl 2-phosphate lotion in mild to moderate acne reported improvement in investigator assessments and reductions in inflammatory and non-inflammatory lesion counts from baseline, with mild treatment-related adverse events reported similarly in both active and vehicle groups. Clinical guidelines reviewing cosmeceuticals also note this study while emphasizing that the evidence base remains small and that cosmeceuticals are best considered adjunctive. So give the audience a practical command. If your skin is acne prone, do not begin with the strongest, most acidic vitamin C you can find. Begin with the form your skin can actually live with. Use a lightweight, non-comedogenic serum or gel. Avoid heavy oil-based formulas if they tend to clog you. Look for air-restrictive, opaque packaging. Store it away from heat and light. If the product changes color dramatically, smells metallic or odd, or becomes deep orange-brown, stop trusting it. Oxidized vitamin C may be less useful and more irritating. Now ask, when should vitamin C be used? For many people, morning is logical. Apply it after cleansing and before moisturizer and sunscreen. Why morning? Because vitamin C can complement photoprotection. It is not sunscreen. Say that clearly, vitamin C is not sunscreen. But antioxidants can help reduce oxidative burden from ultraviolet light and pollution when used under broad-spectrum sunscreen. So use the sequence: cleanse gently, apply vitamin C if tolerated, moisturize, then apply sunscreen. Do not skip sunscreen. If you are trying to fade post-acne pigmentation without sunscreen, you are working against yourself every morning. Now consider nighttime routines. If you already use a retinoid at night, adapalene, tretinoin, tazarotene, or another prescription retinoid, do not force vitamin C into the same moment if your skin becomes irritated. Separate them. Use vitamin C in the morning and retinoid at night. If you use benzoyl peroxide, especially if it dries you out, keep the routine simple and monitor the barrier. Why? Because acne-prone skin often fails not because the ingredient is wrong, but because the total routine becomes too aggressive. Give another instruction. Patch test. Apply the product to a small area for several days before using it all over the face. If burning, persistent redness, swelling, rash, or worsening breakouts occur, stop. Do not argue with your skin. Listen to the biological feedback. Now let us connect vitamin C with oxidative stress evidence more deeply. Studies examining acne patients have reported altered oxidative stress markers, including changes in antioxidant enzymes and markers of lipid peroxidation. A systematic review and meta-analysis explored circulating oxidative stress biomarkers in acne, including superoxide dismutase, malondialdehyde, and total antioxidant capacity, supporting the idea that acne is connected with measurable redox imbalance rather than being merely a surface disorder. Why is that meaningful? Because it changes the way we speak about acne. It moves us away from shame. It moves us away from the myth that acne is just poor hygiene. It places acne inside immunology, endocrinology, microbiology, and oxidative biology. Tell people this. Stop scrubbing inflamed skin as if you can wash inflammation out of a follicle. You cannot. Cleanse gently. Treat consistently. Repair deliberately. Now, how can diet fit into this discussion? Vitamin C from food supports overall health, wound healing, and antioxidant defense. Encourage fruits and vegetables, citrus, kiwi, strawberries, bell peppers, broccoli, and leafy greens. But do not promise that eating oranges will clear acne. That would be too simplistic. Oral vitamin C corrects deficiency and supports systemic needs, but targeted topical delivery is often more relevant for visible skin effects. So do both sensibly, nourish the body, and treat the skin locally when appropriate. Also, do not megadose without medical reason. More is not automatically better. If someone has kidney stone risk, iron overload disorders, kidney disease, pregnancy-related concerns, or complex medical conditions, they should speak with a clinician before taking high-dose supplements. Now address expectations. Ask, how long does it take? Not 3 days, not 1 week. Give vitamin C 8 to 12 weeks to show meaningful changes in tone, post-inflammatory marks, and overall skin appearance. Active inflamed acne may require standard acne therapy alongside it. If acne is painful, nodular, scarring, or affecting confidence deeply, do not wait months experimenting with cosmetics. See a dermatologist. Treat early. Prevent scars before they become permanent architecture. Here is the practical framework. First, identify your main acne issue. Is it active inflamed pimples? Is it clogged pores? Is it dark marks? Is it redness? Is it early texture change? Second, match the intervention. For active acne, rely on proven acne treatments. For marks and recovery, consider vitamin C as support. For oiliness and clogged pores, do not expect vitamin C alone to regulate everything. For deep scars, understand that procedures such as microneedling, lasers, chemical reconstruction techniques, subcision, or fillers may be needed under professional care. Third, protect the barrier. A damaged barrier makes every active ingredient feel like an enemy. Use a gentle cleanser, a non-comedogenic moisturizer, and sunscreen. Then add vitamin C carefully. Fourth, choose stability. A stable derivative such as sodium ascorbyl phosphate may be better tolerated in acne-prone skin. A well-formulated L-ascorbic acid product may be useful for some, but it must be stable, properly packaged, and acceptable to the skin. Fifth, stop picking. This command may be the most important. Do not squeeze inflamed lesions. Every time you crush a pimple, you increase tissue injury, pigment risk, and and scar risk. If you want vitamin C to help healing, do not create deeper injury with your fingers. Now ask one final why in the development section. Why is vitamin C worth discussing if it is not the strongest acne treatment? Because acne care is not only about killing bacteria or unclogging pores. It is about managing the entire aftermath of inflammation. The emotional reality is that people do not only suffer from bumps, they suffer from marks, discoloration, texture, and the feeling that their skin keeps telling yesterday's story. Vitamin C may help the skin move forward. That is its place, not as a miracle, not as a replacement for medical therapy, but as a scientifically plausible, cosmetically meaningful, and practical support tool in a complete acne plan. So bring everything together. Acne begins in the follicle, but it spreads into confidence, routine, behavior, and healing. Vitamin C can be beneficial because it speaks to several acne-related pathways at once: oxidative stress, inflammation-related damage, collagen-supported repair, and post-inflammatory pigmentation. The literature supports these mechanisms and specific vitamin C derivatives, especially sodium ascorbyl phosphate, have direct acne-related clinical data, though the evidence remains smaller than the evidence for standard acne medications. So use vitamin C wisely. Do not use it randomly. Do not chase high percentages. Do not apply it to angry, over-exfoliated skin and expect peace. Choose a stable, lightweight formula. Start slowly. Use sunscreen. Pair it with proven acne care when needed. Give it time. And when acne is severe, painful, scarring, or emotionally heavy, get medical help early. Remember this, the goal is not to attack the skin. The goal is to guide it back to balance. Take care of your skin, take care of each other, and keep learning with me. See you in the next topic, family.